November is National Diabetes Awareness Month, and today we're taking a closer look at how to better understand and prevent this growing health concern. Joining us now is Kim Bush, Director for the UT Tyler School of Medicine Center for Community and Rural Health Education. Thank you so much for joining us. First off, I want to ask, what are the primary differences between type 1, type 2, and gestational diabetes?
Type 1 is going to be diagnosed earlier on in life, usually when you're an adolescent or child. For type 2 diabetes, it usually comes on, it has a later onset in life. Type 2 diabetes, can be prevented. That's one of the nice things, is that we can look at preventing it or at least prolonging it to later in life. And then in your gestational diabetes, that is when someone, while they're pregnant, as they gain weight, they do end up having higher blood sugar levels, where that is affecting their pregnancy. Doesn't mean you're going to continue with diabetes after you have your deliver your baby, but it is a risk factor.
What are some early warning signs of type 2 diabetes and even pre-diabetes that people can often overlook?
Yes, that's very important to be thinking about. So a lot of times people complain of excessive thirst. They're drinking water, they're always thirsty, there's a frequent urination. If you do not get checked out, it's a potential that your vision can be affected. So if you're having, like, one morning your vision is very cloudy, and then later in the day you can see better. So those are some things that can happen as well.
All good information there to look out for. And I know a lot of us can find maybe just minimal ways to change our lifestyle to prevent type 2 diabetes, which you mentioned is preventable. What is the most effective way or lifestyle changes we can make in our day-to-day lives to keep ourselves from developing type 2 diabetes?
Some people think, well, I have to go run 5 miles a day. No, you don't have to run 5 miles a day. 150 minutes a week is the average that someone would need to do to help prevent diabetes. So you really want to think about physical activity, keeping your weight down, eating nutritional balanced meals.
How's the use of GLP-1 or GIP receptors, like the agonist, like Ozempic, change the landscape of type 2 diabetes management?
It doesn't work for everyone, and again, the side effects. So there are different types of treatment for everyone. So that's what's important to remember, that you can't. It's not a miracle drug. So we need to, make sure that we're creating awareness and improving health literacy and having the best outcome for one individual.
All good advice there, Kim. Thank you so much for joining us today.
Yes, thank you.
East Texas